Hi, my name is Pennie Taylor. I'm a journalist who specialises in health and social care. And it's my very great pleasure to have this opportunity to put the Alliance members' questions to the man occupying a political hot seat at a time of great challenge and great change. So welcome, Humza Yousaf, Scotland's Cabinet Secretary for Health and Social Care. It's great to see you here. Now, as you know, Alliance members were asked to submit their questions for you. So the key themes we'll be covering in this conversation are theirs. I'd like to thank everyone who submitted questions very much for this, and for you for taking the time to respond to them directly and from home too. I see from the news that you've been in receipt of healthcare yourself recently. How was it?
Yeah, listen, thanks first of all to you, Penny, but importantly to the Alliance for giving me this opportunity. And I've known the Alliance for many years, far before I was appointed Health Secretary and Health and Social Care Secretary. I've known particularly got a lot of time and respect for Irene Oldfather, Tommy Whitelaw, who are two staples of the Alliance movement as well. So a really great opportunity for me to be able to hear directly from members and take their questions. Yes, you're right. I did that thing that health secretaries, of course, are meant to do, which is think, oh goodness, I better try to get myself fit so I can demonstrate a bit of an example to everybody else. In doing so, and I thought I'd play badminton actually, because I used to play when I was younger and thought, yeah, I've got a racket somewhere. If I rummage around that cupboard under the stairs, found said racket, began to play badminton with my neighbour across the road, who's much fitter than I am. A very good game actually. This may not surprise you. I'm rather competitive, but a really good game. And yeah, halfway through, just felt as though somebody had taken a club to the back of my ankle, a big pop. And the Achilles unfortunately ruptured. So ruptured Achilles. NHS were great with me. I saw a slight panic in their faces when they saw it was me had arrived for treatment. But look, they treated me. I'm pleased to say the way they treat anybody else, and they were great and fantastic and have been. But you know, I am slightly immobile. I've got my crutches and I've got this really. Well, I think it's a pretty cool knee scooter, and my wife thinks it's pretty lame. But I've got you know, a taste of what it's like having, you know, my wife doing a lot of running around after me. But I know that my injury is temporary, and you know, touch wood, I'll heal and I'll be back on my feet. And of course, that is not the case for so many other people, indeed. So I know we'll get into these issues, of course. But again, just a reminder, if ever I needed one, of the amazing job our carers do in particular.
Thank you very much. Now we're going to move on to the questions that have been submitted. We've had a lot of them. So as I say, we've pulled out themes, and obviously the NHS with its massive post-COVID waiting lists, not to mention acute pressure on A&Es being reported increasingly. You know, there's a clear priority for many of the people who post their questions. So we're going to cover that part of your brief first, if that's okay with you. And our first question relates to the NHS recovery plan, which details the Scottish Government's vision for remobilisation of our health service post-COVID. However, Alliance members are reporting that some areas aren't covered. Neurological conditions, palliative care, prehabilitation and rehabilitation. What's happening in these particular areas, Mr. Yousaf?
Yeah, look, so they're exceptionally good questions. And let me say from the offset that what you'll get from me as the Cabinet Secretary from Health and Social Care is complete honesty. I'll always be upfront. I'm not going to pretend to you that I can wave a magic wand and solve the issues of the NHS backlog that has been built up, yes, pre-COVID, but certainly been massively exacerbated because of the pandemic. I'm not going to be able to address that within days, weeks, or even months. It's going to take years to work our way through that. And that's why our recovery plan was the 5-year plan. And that demonstrating how we can increase our capacity by 10%, how we can increase diagnostic capacity, outpatient capacity, inpatient capacity, all of that across the board as best we possibly can, and the increasing £1 billion additional investment that will go alongside that. So that is an upfront and honest assessment of how I think we get there. In terms of the important question that you asked, well, why does it not cover other areas such as neurological, prehabilitation, rehabilitation? These are all excellent questions. So the recovery plan is designed to be high level. If I was to go into every single condition that everybody has and go into that level of granular detail, then our recovery plan would be hundreds and hundreds of pages, and frankly, nobody would read it. But also, the second reason was that we've already got a lot of good work that's underway in each of these areas. You mentioned neurology, you mentioned, of course, chronic pain, you mentioned rehabilitation, prehabilitation. If I look at even just the work that the Alliance is doing for us, I was refreshing my memory just before I came onto this call. I'm always impressed by how much the Alliance is doing with us. And of course, they're on our National Advisory Board for Rehabilitation. And of course, when it comes to that particular piece of work, we have a framework on recovery and rehabilitation from COVID-19. So there's a lot of frameworks and strategy plans that sit underneath the recovery plan. The recovery plan is designed to be that high level.
And are those specific, if you like, to use a phrase, local plans, are they accessible to people that want to know how the services are preparing?
Yes, I'd like to hope so. So look, for each health board, they'll submit their updated annual recovery, remobilisation plans that we'd expect them to do on an annual basis. But also, if I take again one of the areas that you rightly mentioned, which is of huge interest to people across the country, and that's neurological conditions. So in 2019, we published a 5-year neurological care and support framework. That's available, it's published, it's accessible. But I think, and I know you certainly understand this, I think what people want to see is, well, how does that strategy translate into action? The strategies can sit in a shelf, but the strategy is only as good as its implementation. And that's where the Alliance is really helpful to us, because they advise us, well, here's what members are saying on the ground. Yes, you are making progress, but here's where you're falling short. So again, just to give you an absolute assurance, just because something isn't detailed in granular level in the recovery plan, every single area and aspect of our health service and the service it provides is absolutely being thought of in terms of recovery, remobilisation and renewal.
That's good to know. Now, I'm aware that we've got limited time and we've got a lot of questions to cover, so I'm going to move on and ask about a question that relates to equity of access to specialist nurses. This comes from a person living with cerebral palsy, and they say adults with cerebral palsy have unique needs and a condition that affects all body systems, yet health professionals lack knowledge and access to services is poor and doesn't meet people's needs. This is the feedback from an individual. This has been their experience. Why do people with cerebral palsy not have access to named specialist cerebral palsy nurses similar to those which, work and support people with other conditions such as Parkinson's or multiple sclerosis? Is there any plan to extend that?
Yeah, look, I'm more than happy to give that further consideration. What we've said when it comes to the remobilisation of our NHS is we will come towards the end of the year with further additional information around our workforce planning. It's challenging, and again, as I mentioned to you at the very beginning of this call, I'm always going to be upfront with people and not say, look, I'm going to promise you something that I can't or won't be able to deliver. What we've got is a significant challenge in how we remobilise. We're going to have to make sure we use our services, our specialists, our workforce in the best way possible. So that's not to rule out at all specialist nurses for cerebral palsy. I think that's worth exploring, worth considering for sure. But if we can get a better outcome for the individual and at the same time not have to dedicate specialist resource for those individuals, then it may be worth exploring how we get the same outcomes. So I won't rule it out, but certainly when it comes to the work we're doing on workforce planning at the end of this year, I'll promise to give this some further consideration.
Thank you very much. I'm sure that'll be appreciated by the person that put that question. Now, moving on, we took quite a few questions from mesh injured women who want reassurance that they haven't been forgotten. One says it's all gone, and I quote this person, they say it's all gone suspiciously quiet. For instance, on plans for sending women to America for treatment. Can you clarify what's happening for them?
Yeah, I can. And look, let me first say to that individual, forgive me if it is being quote unquote suspiciously quiet. Often once we've announced a tender we have to then work with those individuals to just finalise contracts, and that's a little bit of what's happening at the moment. Since I've been Health Secretary, I've been really pleased to do a few things. One is to confirm that we're introducing, of course, that bill for reimbursement for those women who've already had to pay for mesh removal. So be absolutely assured that you'll be reimbursed for the costs of that surgery. So that's one piece of work that's undertaken. The second piece of work that I announced at the beginning of July, or 12th of July, I think, if I remember my dates correctly, was that we have asked the NHS to tender, to put out a tender for additional services for mesh removal out with NHS Scotland. And on the 12th of July, we was able to announce the two successful contracts that were awarded, one to Spire Healthcare in Bristol and the other to the Mercy Hospital in Missouri. That's Dr. Veronica's clinic, who many mesh women who've been affected by mesh are quite keen to go to Dr. Veronica's for mesh removal. So what will happen now? We've got a range of options. So you've got the complex mesh removal service here in Scotland. You can be referred to a specialist service in England. You have the option of Spire in Bristol, Dr. Hasham, or you've got Mercy Hospital and Clinic, which is Dr. Veronica. So a number of different options. And what I'm really keen to ensure and to give a reassurance is that a woman's choice and preference will be central to where they end up going. And we know, and I'm sorry this is the case, but we know that a number of women don't have the trust in the NHS here in Scotland because of their past experiences. And while I regret that, I do respect it. And therefore, if their desire is to go elsewhere, they will. So that's the slightly long answer. The short answer is we're getting extremely, extremely close to finalising those contracts with Spire and Mercy. Once we get those done, I'll then be able to communicate, hopefully in a matter of weeks, no longer than that, in a matter of weeks, what the referral route will then be for those women to hopefully get the care that they need.
Thank you very much. Now, as you know, the Alliance recently launched a survey on chronic pain. You referred to chronic pain earlier when we started talking. What assurances can you give that the responses to that survey and the voices you will hear, that they'll be listened to and acted upon?
Well, look, first and foremost, I go back to my opening comments. I'm a great supporter of the Alliance. I have been for many years, even before I was in ministerial office. It helps that my constituent is Tommy Whitelaw. I wish you should give that away too much, but he's a constituent of mine and is not too far away from my constituency office. So as a regular attendee and popped into my office quite often when we were able to do such things pre-pandemic. So look, I'm a great supporter of the Alliance. So anything the Alliance does, particularly because I know that they go to people on the ground with lived experience, and that's why they're so valuable to us. Anything the Alliance brings forward, to me, is given considerable weight. I recently met with Ian Welsh and with Irene Oldfather, and chronic pain was one of the issues, unsurprisingly, they wanted to raise with me. So I gave them an absolute assurance that the work that they're helping us with to understand the needs of those with chronic pain better, that will be a real priority for us. And I go back to my answer to you about the recovery plan. It may not be there in the high-level recovery plan, but an absolute guarantee that chronic pain and those who unfortunately throughout the pandemic had to suffer with that chronic pain, remobilising services for you is a really, really top priority for us.
Thank you very much. Or else we'll have Tommy Whitelaw around chapping on the door. So that's good to know. The Alliance's reach is immense. We're going to move on now to talk about one of the most significant pieces of legislation on the horizon in Scotland, which is the creation of the National Care Service. Yeah. Now, I noticed that it won't be here until 2026, which feels a long time away. I hear what you're saying about what needs sorting out, but for anyone experiencing the pressure out in the community, 2026 feels like a long time. Yeah. And the community-based third sector, which really stepped up during the pandemic, as you know, to support people in really creative ways, it's saying that it's struggling to survive on short-term funding. Grateful, as everyone is, for that. How can we move to kind of long-term sustainability for our vital third sector? And what will it take to make that happen, Cabinet Secretary?
Yeah, so look, again, a set of really good questions. I'm not surprised that Alliance members are interested in these issues. if I take the first one first, so the question on the National Care Service and the time it takes, you're right, it is frustrating, but we'll move at a pace as quickly as we can. That's why in the first 100 days of being re-elected, or the formation of the new administration, I should say, we launched a consultation on the National Care Service. So didn't wait about, didn't hang about. I've got that consultation out, and where we can move quickly through the legislative process, I'd be really happy to do so. But given the scope and the breadth of the National Care Service, which we might touch upon later perhaps, there's no doubt that the committee and the Parliament will want to take its time, taking evidence from as many stakeholders as they possibly can. And quite right that they do that too. So what we say is that by the end of the parliamentary term, we hope it would be fully operational. Now that doesn't mean that we can't make changes now, and we are making changes now to the National Care Service. So don't expect that by what I'm saying, that we're just going to again sit on our hands and not make any improvements to the social care sector as it currently is formulated. So we will, and we have. One example I can just think of from the top of my head is, of course, the increase in salary and wages for those who are providing important and vital social care services to our social care workers, making sure that they're paid at least the real living wage, which has been, I know, a big boost. But we are being asked to go even further, and that's something that, of course, I'll consider as best I possibly can, considering the pressure on social care. In terms of the second part of your question, vitally important. In terms of long-term funding, our biggest gripe as a government, and don't worry, I'm not going to stray too much into politics of this, but our biggest gripe as a government is we often get one-year budgets from Westminster, and that means that we have to do one-year budgets, and that is really unhelpful for the third sector, because taking on a post or recruiting people for a project, if you've only got 1 year certainty, is extremely difficult and not ideal, to put it mildly. What I'm hoping we can do is, with the cooperation agreement with the Greens, is that we're able to look at actually, can we give longer term funding assurance, multi-year? Might not be able to do that for everybody, but certainly for the third sector, where they're so reliant on having funding reassurance, then can we do that multi-year as opposed to single year? And I think if we're able to do that, then hopefully that'll give the reassurance to the third sector.
It's interesting because you mentioned the need for investment now. We've had the Convention of Scottish Local Authorities, COSLA, basically, which it's not in favour of the National Care Service as set out so far. But they're basically saying that, there may not be investment in services in the meantime. Is that a risk?
No, and I would encourage my COSLA colleagues to let's debate the differences, but let's do it sensibly. Let's not alarm people. Let's not engage in hyperbole in any way, shape, or form. That's unhelpful. I accept, and always accepted, that we're going to bring forward a plan for a national care service that local authorities would probably have some concerns, and I'll listen to them. My colleague Kevin Stewart, who is doing a lot of the hard work behind the scenes on the National Care Service, he will meet with COSLA regularly, as I will do too. But let's not alarm people, I think, is really important. So the investment in social care funding, we've of course promised to increase that funding by 25%. That's around 840 million of increased investment. So if anything, the investment is going to significantly increase over the course of the parliamentary term, not decrease.
Thank you. Our next question comes from the Coalition of Carers in Scotland, another really important group. Throughout the pandemic, they say, Scotland's unpaid carers, family carers mostly, have had to step in and provide more care, while many health and social care services have been reduced or suspended. This has impacted negatively, they say, on carers' physical and mental health, and many have not had a break in this time. What will the Scottish Government do to address the needs of unpaid carers, both in the short term and in the longer term? So a related question.
Yeah, and again, understandably, these questions are being asked. I can't imagine how difficult it must have been being a carer during the pandemic, being a carer at any time, frankly, but let alone during the challenges of the pandemic, which I have to reiterate, of course, we're still in the midst of. It's not a case just because, the restrictions have eased, that somehow the pandemic is away. Now we're just having to in some sense, just see what we can do in order to bring back some sort of normality, not completely or entirely, but some sense of normality we're trying to speed up our vaccination effort as best we possibly can, because going into perpetual lockdowns, of course, is not good for people's mental health, let alone their physical health, and let alone the public services that we're so reliant on, including the NHS. So a really difficult balance to get right. I'm not saying we get it right every time, but a really difficult balance to try to get right. So for our carers, lots that's been done, and I won't rattle through everything because of time, but from the carers allowance, for the additional supplement, for the Carers Act, of course, which enshrines some really important rights for our carers, but also that point on short-term breaks, I think, is extremely, extremely important for the mental and physical health of our carers. So I'm just looking through my notes before I came on this call. We've added an additional 1.1 million to the annual 3 million voluntary sector short break fund. So there is additional funding for that short break fund, and I'm happy to. The Alliance will have all the details, but happy to post that detail to our social media accounts just to make sure that people are applying. Because often in the busy lives that carers have, my goodness, how do you find time to look at what fund is available and so on and so forth? So if we can make that easier, then I'm more than happy to do that. But please be assured, if you're a carer listening to me, that nobody in government is unaware of the significant challenges you face, and whether that's short term or long term, then there's a range of actions being taken. But please, if you think there's more that we could and should be doing from a government perspective, I'm always keen to hear from you.
Thank you. Now, a lot of the carers, very many of the carers that I know, have spoken highly of the involvement that's gone behind the formulating of the National Care Service. And this question relates to that. It's from the Scottish Recovery Network. They and others want you to outline what steps the Scottish Government is going to take to develop the strong relationships and engagement with people who have experience of health and care, and the third sector, building on that innovative work that's been undertaken during the pandemic. Are we going to keep it going?
Yes, is the short answer. But it's in some sense frustrating, because it shouldn't have taken, of course, a pandemic for us to work that closely with partners like the Alliance and others, the Coalition of Carers, many others, to actually get the voice of lived experience, not just after the decision has been made or when we're at really kind of almost end stages of formulation of policy, but the very inception stage and phase of policy development. And that's why I'm really pleased you mentioned that you've heard from a number of carers, but others in relation to the National Care Service, that we're doing that right at the beginning. And we certainly hope to continue to do so. So we created, as you know, the National Covenant, the Social Covenant Steering Group. That is made up from lived experience right across the board when it comes to care services, not just adult social care, though as important as that is, but right across the board. And that's invaluable. They've already challenged us in government, and that's why the scope of our National Care Service consultation is so ambitious. If it was left, I think, to government, they may have been quite cautious in terms of, well, not moving beyond Feely and the Feely review, but actually it was a lived experience and the voice of the lived experience said, look, you've got a once in a generational opportunity here. Don't waste it. And I think about, for example, the transition between child services and adult services, and think about the National Care Service being more ambitious. So look, if there's an assurance you're looking for, then absolutely, because we gain a huge amount of value from that work. And the Alliance are involved in a lot of that, but not just the Alliance, a number of organisations bring that lived experience to the table.
Now we come to COVID and COVID questions. And here's a question saying that many disabled people with long-term conditions and unpaid carers are very concerned about the removal of restrictions in mass gatherings, no mandatory mask wearing, etc., etc. What can be done to ease their concerns given the ongoing risks to their health if they were to get COVID?
Look, first of all, can I say that nobody in government is dismissive of the concerns that carers and those who are clinically extremely vulnerable, that they must be feeling extremely anxious. I know they're feeling extremely anxious because many of them excuse me, make contact with me direct, or indeed through other colleagues as well. So nobody in government is dismissive. I hope you can also understand that we face a really significant challenge We are trying to ensure that people's mental health as well as physical health can return back, can get the attention it deserves. And by returning to at least a level of normality, we're not at normality, but some level of normality, then we can resume those public services that are so vital. We just spoke a moment ago about chronic pain and how many of those services were suspended or not being delivered in the way that they would have been pre-pandemic. How that has exacerbated that chronic pain many people have felt. So we've got to remobilise those services, as well as other really vital public services as well. So that's why we've moved to a position where we're able to ease restrictions. And we know that because the vaccine rollout has been so successful, then fewer and fewer people are being hospitalised in that percentage of positive cases. So around 3% are hospitalised compared to 13%. But of course, many of the people that you're caring for are within that 3%. So hence why I know you're more anxious than perhaps others around the easing of restrictions. And what I would say is two more things. One is that we're keeping in place baseline mitigation measures, face coverings being one of them, wearing those in indoor public settings and in public transport. And I was on a train on losing my days on Friday. I was really pleased to see that almost everybody was wearing a mask. Similarly, when I'm going into the supermarket, I'm still seeing people, generally, not everybody, I'm sure there'll be some people who won't do it in the same level they were doing before, but certainly the vast majority of people still wearing their face coverings, which is really important. And I suppose the second thing I would say is, I promise you we're monitoring the data every single day, and we're monitoring the impacts, including on the most vulnerable, every single day. And while I am not looking to reimpose, the government's not looking to reimpose restrictions, because we want to try to see if we can enforce those baseline mitigation measures better, we've never ruled out if the situation becomes so challenging and is beginning to have an impact on people's health, to such an extent that we'd have to think about the reimposition of restrictions, then there is always a reverse gear if it's needed.
Oh, okay, that's really interesting, and it's good to know that the data is analysing the impacts on the groups that have been mentioned here. Now, at the time of this recording, the COVID passports, as people are calling them, are being introduced, and there's a bit of concern about that. Are they an alternative to lockdowns? I mean, I heard you just now say no, because if lockdowns are needed, they will come back. Yeah.
So, look, on COVID certification, bear in mind there'll be a parliamentary debate this week, and hopefully we'll take as much Parliament with us as possible. And then, of course, we'll outline our detailed plans for implementation of any scheme. What I would say is, look, there's two primary purposes. One is to increase incentivisation of vaccination, particularly amongst a younger age cohort, where the vaccination uptake is lower than it is for older age groups. And then the second point is to help us control transmission, particularly in high-risk settings. So nightclubs would be an example of a high-risk setting. The ventilation is poor. The age cohort generally, unless you're Michael Gove, is usually younger people that tend to go to nightclubs, and again, their vaccination rates are lower. But also, of course, the types of behaviour you see in a nightclub, that kind of close contact, if that is not too much of a euphemism, that close contact generally is the type of behaviour that could help to spread the virus from person to person. So it's very limited in its scope. What I would say is that, yes, actually, in some respects, if we can bring in COVID certification or vaccination certification, then hopefully that would be an alternative to lockdown. But of course, if the situation deemed it necessary to bring in restriction, we would do that. But you're absolutely right. One of the reasons for looking at COVID certification is to hopefully avoid lockdown, which we know is a lot worse for industry and business who've suffered a lot during the last 18 months.
Now, long COVID, people are afraid of, and the organisation Long COVID Kids Scotland, they're saying that children in Scotland who are suffering from long COVID are struggling to get access to treatment and support, as their GPs that simply don't know where to send them or who to refer them to. Will the Scottish Government consider setting up specialised long COVID clinics in Scotland, as England has done? And if clinics can't be provided, what other options are being considered?
Yeah, I'll answer that question in just a second. Before I do so, if long COVID Kids Scotland would like, because I understand their concerns, my national deputy clinical director, he sits just underneath Jason Leach, John Harden, Dr. John Harden. He leads on some of our long COVID strategy. I'll ensure that he meets with Long COVID Kids Scotland if they wish to meet to discuss that. And of course, I'd also make myself available, but John Harden's doing a lot of the hard work at official level if they'd like. So please just come in through the Alliance and then we can make that happen. On the broader substance of the question, which is really important. So I wouldn't rule out long COVID clinics. And in fact, if a health board thinks that that's the best thing to do in their local area, then there's nothing stopping them setting up a long COVID clinic at all. They can do that today if they wanted to do so. I think the reason why there's probably some hesitancy is at the moment, if you think about it, first of all, a long COVID clinic won't necessarily work for everybody. If you took NHS Highlands, that kind of vast geographical area, if you had a long COVID clinic in Inverness, that's not really going to be sufficient for people in Skye or Wick or wherever it may well be because of the distance that you necessarily have to travel. But also from a resource point of view, people that, for example, are suffering from, let's say, breathlessness and brain fog and
fatigue.
There's 3 or 4 different symptoms that you might be suffering from. You would then have to ask the question, well, who would then staff a long COVID clinic? You'd have to pull in specialists and consultants from respiratory. You'd have to do it from neurological and neurology. You'd have to do it from all these different departments, and you'd take them away from where they currently are and you'd bring them into this kind of specialist clinic, and taking that resource away might not be the best way to do it. So we do already have referral pathways into the likes of respiratory, into neurology for people that are suffering those symptoms. What I will say is we're also trying to learn more about long COVID because clearly our understanding on this is evolving. So a lot of the funding that we've given has been on the research side. But look, I accept that doesn't help with here and the now. So I'm hoping to outline more of this. We're hoping to have a parliamentary debate on the NHS more generally. It was meant to be this week, but because of COVID certification, I think it'll be pushed into next week. And I hope to say more about long COVID and a strategy towards long COVID, because I think there is more we can do. Hopefully be able to say that in the next couple of weeks.
Thank you, Cabinet Secretary. Now, another big meaty issue in Scotland is health inequalities. They were pretty dire before COVID, but evidence is emerging that they're getting far worse. There have been reports of a 25-year difference in the lifespan between of a man living in a poor community and a rich one. What action is being taken to address health inequalities experienced by particular groups, including those who have been most disproportionately affected by COVID? And that includes women, disabled people, people from minority communities, and people living in poverty. Are we thinking about health inequalities as we're having to think about everything else in terms of remobilisation?
Yes, again, would be the short answer, but let me expand upon it. This is probably going to sound a kind of strange way of phrasing it, but the pandemic has presented an opportunity to really weed out some of those systemic inequalities that existed in the system beforehand. They existed actually not just in the health service, but they exist right across various different parts of our society. So there's no surprise, and I remember seeing this as Justice Secretary, that our prisons are full of people from poorer backgrounds, from our areas of highest deprivation. They often tend to be the ones who are at the end of violent attacks, for example. So this is that's just one example. We could give you multiple examples right across society and across government of where inequalities, I'm afraid, lead to worse outcomes. If that doesn't sound like it's stating the obvious too much. And so the work that's been done by the Deputy First Minister, he's been given a role, as your listeners and viewers will know, he's been given a role in terms of COVID recovery. And part of his role is bringing in government as an entirety to say, we will not be working in compartments, we will not be working in silos. And, let's take somebody's journey from the beginning, actually pre-birth, right the way through. And let's make sure we're intervening at the appropriate times to make sure that we're weeding out those inequalities in that person's life. So the DFM is doing a lot of that work. At the root of this, of course, for many of these inequalities, undoubtedly, is poverty. And so much of the government's work has been focused on trying to reduce poverty. And again, I won't go into all the detail of all the things that we're doing, but just one example would be the Scottish Child Payment, to which we've doubled, and we've given a commitment to double again over the next few years. Now, some people want us to go quicker and go faster, and again, we'll obviously examine that and explore where we can do that. In terms of other inequalities that exist, look, take it from somebody who himself is a minority, I'm only too acutely aware about the disproportionate health impacts on ethnic minorities. So we have set up an advisory group who are due to publish their findings very shortly. Let me just check, they actually haven't. They're due to be published. The immediate priority plan for race equality due to be published very shortly as well. So that will be looked at and explored and examined as well. So there's if it doesn't sound too perverse, absolutely an opportunity to weed out those inequalities. That's my intention when I look at the recovery plan. I'm going to make sure that we're not just doing things the way they were done before, and making sure we weed out some of those inequalities.
And are you confident that we can start to close this yawning gap?
Yes, because we were to some extent beginning to do that pre-pandemic. So if we looked at the healthy life expectancy for a female, we were making some progress. We were reducing that gap between the least deprived and most deprived areas. But I've also got to hold our hand up. We're not going to have me in government as a minister saying we've got it all right, everything is going in the direction we want it to. No, you've read out some really challenging statistics. And as a government, I can give you an absolute promise from having spoken to the First Minister about this on many occasions, that we are absolutely committed in the areas that we haven't made the progress we want to redoubling our efforts.
Thank you so much. Now, as you will know, one of the Alliance's core aims is supporting self-management. Do you see self-management being part of the NHS recovery plan? Is it going to feature?
It's vital. It's a core component. If I think about the challenges we're facing at the moment, we want to ensure that people are only coming to acute services and to hospital for a shorter period as possible. We want people to be treated, whether it's hospital at home, we want people to be treated at home as best possible, but also when it comes to the conditions they're living with, to be able to manage them so they can live as independently as they possibly can and have that care at home, as opposed to having to go to a specialist clinic or go to a hospital and so on and so forth. So yes, absolutely. The Go On Yourself strategy, which has been around for a number of years now, which of course the Alliance, again, pivotal in the self-management fund that they've helped to administer, I think has been a great success. I was able to announce some further awards of that particular fund throughout the summer. So I think there's been great success in that. But yes, I mean, not just is it a nice to do, it's absolutely vital to our recovery plan. You know, given the scale of the backlog, given some of the challenges we're facing on the delayed discharge end, for example, you know, it's absolutely a vital component of our recovery plan.
Thank you. Now, Self-Management Week in Scotland starts on the 27th of September, and the Alliance has a campaign inviting people to share their personal stories of what keeps them well, what supports their well-being. Might be reading, walking the dog, who knows, it might even be a spot of badminton. So Cabinet Secretary, to bring this question time session to a close, what would you say keeps you well?
Yeah, and can I give you a really honest answer, which is, actually, I don't think, truthfully, I've been very good at practicing what I preach. I don't think I've kept myself well, if I'm really honest. I think as government ministers, and look, I'm not expecting any sympathy whatsoever, we get paid well, you know, we're in a really privileged position, but I think, you know, we end up almost burning the wick at both ends. And you know, sometimes in society we look at the phrase workaholic and we go, oh, that's a badge of honor. Actually, I think it's quite the opposite. I think if you're a workaholic, and look, we'll all work hard and extremely hard, but if you're a workaholic, you're sacrificing time with your family, your friends, the kind of stuff that keeps you well. And for me, I've maybe just come to that realization recently, and gone, you know what? I need to rebalance a bit of my life here. And I've got a 2-year-old, a 12-year-old, different ends of the spectrum, different needs, but my goodness, they've got needs. And I want to spend more time with them and my wife, but also the badminton, although we're making a joke about it, the point of the badminton was I felt to myself, okay, physically I need to get a little bit healthier, but physically I'm not too bad. But actually, it was the mental health aspects of it that I was really looking forward to. Just when you're on that court, quite competitive, and I won't lie, I'm a bit competitive, quite competitive. You know, I'm not thinking about anything else for that hour. I'm just thinking about how I win the game. And for me, that's why it's so important. And even throughout the day, if I can just take a little bit of time, okay, I'm not doing much walking at the moment, as you'd imagine, but even just getting outside for a little bit of time, 10, 15 minutes, does wonders for me. So I think it's a really great campaign by the Alliance, and I'm going to get better at practicing what I preach to others.
Thank you so much. And I hope you get back on that badminton court double quick. So that brings us to the end of this, as I say, question time session. And I'd like to thank once again the Alliance members who posed their questions, and to thank you, Humza Yousaf, Cabinet Secretary for Health and Social Care in the Scottish Government. Thank you very much for your direct, frank, and as you say, honest answers. And I'm sure I'm not alone in wishing you the best of luck in rising to the challenges we face. Yeah, really.
Thank you so much.
Thank you.
No, thank you for that. And again, my thanks to all the Alliance members that took time out of what is undoubtedly a busy life that you've got to ask questions. Look, I'm more than happy to hopefully do more of these sessions in the future too.
You're on.
Great. Thank you.